Good morning, Namaskar. I am Dr. Shweta Mathur from Apollo Hospital, Noida, a senior consultant at the Department of Dental Sciences. It's indeed a pleasure to talk about a very important and pertinent topic, which is going to be a topic for discussion today, smile enhancement by dental aesthetics. When we talk about dental aesthetics and beautification, at times people interpret it as wrong as just a matter of exhibition or improving your appearance. Dental aesthetics is not about beauty alone. It's about empowering my patient with confidence and to face the ability to face the world with squared shoulders. So aesthetics, as far as your smile is concerned, is definitely of prime importance to shape your personality and to stand before the world. Smile, as I tell to everybody, is a curve that puts everything straight. So taking care of that smile is of our duty, not nobody else's. A smile primarily depends upon two facial or skeletal features. One is the hard tissue and the other is the soft tissue. Now, the hard tissue comprises of our bone contours and our teeth. And the soft tissue, which enhances the smile, depends upon the gums, the lips, and your visibility of the gingival tissue. Now, first, we'll take each section separately so that we can understand this better. We will first talk about teeth here. Why? Because it is the first thing that is visible when we smile. So a lot of people have multiple complaints. However, the most common complaint that we have faced is that the teeth are yellow. मेरे दांत पीले हो गए हैं. Yeah, my teeth do not shine as brightly as they used to be. Now, why I'm using these patient terms is because a normal person, a layman, can relate to these sentences better. In our language, we say that these teeth are stained or they have a layer of plaque or a calculus and may require certain cleaning and aesthetic procedures to go by. Most common complaint of yellowing teeth is dealt by first cleaning and removing debris from the teeth, and the second by doing our dental bleaching. What is bleaching? Bleaching is to brighten up my teeth. Now, when I say brighten up your teeth, I also advise my patients that brightening up of teeth does not mean to make your teeth appear white. White is not normal. A shade which matches with the tone of your skin is normal. So for every individual, the shade of the tooth will be individual or different or specific. So there is no rule that one should have white teeth. Dental bleaching in the dental office is conducted in a very easy way. It's an absolutely painless procedure. I know there are a lot of inhibitions attached, but there are a lot of new techniques like lasers, which has brought a revolutionary change in dentistry. By the use of lasers, we do dental bleaching in our office in a matter of 30 seconds. This results in no sensitivity, no pain, and no discomfort to the teeth or the surrounding soft tissues. The second complaint that we receive most commonly from our patients is that they have stains on their teeth. Now you have to understand the difference between yellowing teeth and stains on the teeth. Yellowing teeth may occur due to prolonged use of cold drinks, eating habits, namely the mustard sauce, which is very prevalent these days, or certain habits which are associated with your eating or lack of oral hygiene. Stains on the teeth, on the other hand, are a different problem. Why different? Because these stains can be intrinsic. Stains which cannot be dealt or cannot be removed by any external measures. These stains commonly occur in people who have defective enamel, or as we call it, enameloplasia. These defective enamel spots cannot be removed, but can be covered. How? By the use of very easy method which we call veneers, which can be as simple as composite or as beautiful as ceramic. So in this procedure, we make beautiful curtain-like layers over the surface of your tooth and thereby improve your appearance, enhance the color of your teeth, and thereby provide confidence to our patients. Some of the teenagers approach my dental office with a complaint of having crooked teeth. Now, crooked teeth or malaligned teeth, as we call them, is one of the major issues for hampering one's smile and presentation. These crooked teeth should be treated at the age of 11 to maybe 13 so that they do not show their repercussions at the teenage when the kids are most conscious about their appearance. Malaligned teeth can occur due to a lot of reasons. Again, we have it can be orthodontic, it can be related to the bone deformities, it can be due to teeth malalignment, or a combination of both. Which treatment has to be implemented for whom is definitely recommended after a study of a battery of x-rays and investigations. However, it's a very common practice that has been practiced for years that the teeth are aligned by the use of wires or by using ceramic braces or metal braces as required by the patient. This treatment takes approximately a year and sets your tooth right in the beautiful curved smile. These days, a very effective treatment has also been launched by the dental offices in which no wires are used. Now, this treatment is called the Invisalign. You must have all heard about it. Invisalign is a treatment where a battery of molds are provided, which are made upon a prefabricated or pre-imagined result. Now, this Invisalign treatment is very beneficial, extremely beneficial for that matter, because anybody can go and get it done, irrespective of the age, of the fact that they are working in offices, irrespective of the age that they are studying in colleges, or irrespective of the age that they are over 40. So Invisalign definitely has paved a bright way towards alignment of teeth. At times, some of the patients may also have visibility issues in their teeth. Some people complain that their teeth are not visible at all. Now, to understand this complaint, one has to first understand what is normal visibility. Because I have encountered patients who have come with me with unnecessary apprehensions because some peer pressure has been launched into them in school and colleges, and now they are under a negative feedback that they don't look good. So first we have to empower our patient with the knowledge. Not all patients need to be treated. So first we have to understand, and you have to study me probably when I'm talking, that when I'm talking to you in a normal manner, only the lower 1/3 of my upper teeth are visible. And my lower teeth may not be visible at all. So the visibility of the teeth this is how the normal visibility of the teeth is according to our measurements. Some people think that their teeth are not visible at all, which may be true, which may be because my teeth have undergone a rigorous attrition because of habits like bruxism or grinding or applying so much pressure during exercises. I encounter a lot of patients who are gym enthusiasts, who love exercising, lifting weights. They clench their teeth in a manner that their teeth undergo attrition, thereby decreasing their visibility of the upper teeth while speaking. So much so that nobody can see their teeth and gives them a very weird appearance. This problem can again be dealt with by giving veneers, by first freeing the patient of this habit, by giving veneers, because veneers can again get attrited if the habit is not treated, or by giving crowns, which are more sturdier and can resist the bite forces. Most of these problems related to the hard tissue can be dealt in a non-invasive manner. However, when it is about soft tissue, we have to understand that when we are talking about soft tissue structures which affect the smile, we are talking about lips. Then we talk about gums. And then we talk about the visibility of either. Now, when we talk about lips primarily, we see that some of us have dark stained look on their lips. Some have bright rosy lips. This again, to be very frank, should not be treated as a disease. It is just our genetic framework. People who have higher melanin pigmentation tend to have darker lips, and people who have lesser melanin pigmentation tend to have brighter lips. Lips can enhance your beauty, and therefore we advocate that all the people who are conscious about the appearance or the shape of their lip should undergo a laser procedure where we remove excess of melanin pigmentation from the lips and make your lips look beautiful, rosy, and supple. This procedure may need to be repeated over a span of 6 months, but we've usually seen that 1 or 2 sittings tend to give you a permanent change of color. Second thing is the gums. Now, when I talk about gums, I don't only talk about their hygiene, I talk about their visibility, their color, their shape. So first about visibility. A lot of people, when we are sitting in a crowd or a group, if you observe, you will see that a lot of us when we laugh or we smile, we can see the gums of the patient or the person before us. According to the visible standards of aesthetics or the measurements that we follow, visibility of the gingival, marginal gingiva is acceptable, but visibility of the alveolar gingiva or the gums above your bone of the jaw is not an acceptable feature according to dental aesthetics. हम इस चीज को कॉमनली कहते हैं गमी स्माइल, कि उस बच्चे के बात करते समय मसूड़ा ज्यादा दिखता है. मसूड़े की इस विजिबिलिटी को कम करने के लिए we have to understand on what factors this happens. Sometimes the frenum attachments of our lip is in such a manner, position, consistency that whenever we open, speak, smile, it pulls the lips away from the teeth, thereby making the gums visible. This procedure or this defect can be treated by reshaping or eliminating such tight lip contacts, which is called frenoplasty or frenectomy. The gingival visibility can also be altered by beautifully reshaping the gingiva. What is reshaping the gingiva? By giving it beautiful contours by the use of a lasers, which is a painless procedure. This procedure is called gingivoplasty, which means reshaping of my gums. In certain patients, due to use of certain medicines, which primarily we've seen patients who are using hypertension medicines for a prolonged period of time, may develop certain gingival growths or outgrowths. These gingival outgrowths tend to give not a very pleasing look when the patient is talking, and also interferes with the general hygiene, because whatever I eat rests on these outgrowths. These outgrowths can also be treated by use of lasers or by a surgical blade, whatever is required and feasible according to the patient. And the gums can be given a beautiful shape and thereby increases aesthetics of the patient. The most common complaint that I encounter in my dental office are the teenagers who come to me and say that they are shy of smiling because their lips, their gums are very dark. Now, this gums darkness is again a similar situation to our lip darkness. This, in our common language, we refer to them as chocolate gums, because we encounter this problem with the generation who loves chocolates. The gum pigmentation or depigmentation is a very easy procedure that we do with the use of our lasers at Apollo. And depigmentation, that is the removal of excess of melanin pigmentation, is done to achieve beautiful results and instilling confidence in my patients. This procedure, let me specify and assert again and again, is an extremely painless procedure. So please do not be hindered by certain inhibitions. This we in our language call as gum bleaching. We also have certain diseases which reflect on my gingival health, which is of course a long list and should be treated in specific, but it is very important to mention here that not all treatments are applicable to everybody. So a judicious judgment of what treatment will answer which patient is required. Towards the end, I would like to mention one such disease, which is most common in our Indian subcontinent. We as Indians have vitamin D in abundance, but due to our culture, due to our the type of clothes that we wear, due to the heat that the sun emanates, we are unable to absorb that vitamin D. In that situation, most of the Indians in the age bracket of above 50 to 60 have shown deleterious vitamin D levels or calcium levels, and therefore I have seen, and you have also must have observed in your surrounding neighbors, families, relatives, that the teeth tend to flare outside. Especially the lower anteriors tend to flare outside, pushing the lower lip out as well. Now, if you compare your image with with a photograph of your younger times, photographs are a very common feature these days. So I think all of us have lots of photographs. When we compare our pictures from the younger age, that's when we realize the difference. Because when you see yourself every day, you get accustomed to your image. So these teeth which tend to flare out result in gaps between your teeth. Now, this is not for aesthetics, but this interferes with my health. So we do a beautiful thing or a combination of treatment where hard and soft tissue both are involved so as to eradicate these gaps and give my patient aesthetics along with health. So here we decontaminate the gums. We remove infection, we give systemic therapy of vitamin D, calcium, so that the bone is strengthened and we make the bone infection-free at the same time. Then we splint the teeth so that further flaring is not done. And then we provide veneers so that these gaps are taken care of. Now, this is a very common day-to-day practice in our practice at Apollo, because this disease is the most common disease that occurs in our subcontinent and is most commonly referred in small villages, towns by the name of pyorrhea. So this needs to be treated. First, the gums need to be treated, and then aesthetics need to come into play. Why I mention this disease? Because this you will find in your households as well. So I would love it if you spread the word of consciousness amongst the others as well. To sum my lecture for today, I want to stress that dental aesthetics is not about looks. Do not always consider that beauty is important, but the confidence associated with your appearance is most important. So I want all my patients and all the people who are hearing this lecture today to be confident in your appearance. This is an era of digital existence, and therefore digital smile designing plays an important role. You can be your doctor yourself by following a simple thing which I'm going to talk about. So please listen to this carefully. Your smile can be judged by you by understanding the concept of E-line. What is the E-line? E-line is a line that starts from your most protruded part of your nose to the most protruded part of your chin. Now this E-line should be a straight line. The upper lip should be 1 to 2 millimeters behind the E-line, and the lower lip should be 2 to 3 millimeters behind the E-line. If this is your configuration that you get, you sit at home, and if not, then you come to us. So remember, smile is your first impression. Make it your best. Thank you.